Swell ladies. I thought of you today and wanted to share some info that would help us as women to lead empowered lifestyles. My name is Marcia Chambers, aka Speaker MC, creator of SWELL for Women. That's Sexual Wellness and Empowered Living Lifestyles for Women. Every Tuesday, I share some random information that relates to our overall sexual wellness so that you can confidently unleash your inner goddess. Today, we're speaking about something that is crucial to our sexual wellness, ED, or LDS, as we say it in the Swell Playroom. We're talking about interesting facts about ED, erectile dysfunction, or LDS, as we say it in the Swell Playroom, which stands for limp dick syndrome. Yeah, I know. But ED is such an important alert to a man's heart health. Yes, his cardiovascular health. So you should take note, ladies, because this is important to you as well. It's very common to at least 52% of men between the ages of 40 to 70 years old. They've had at least one episode of ED. So if it happens and he says, "This never happens to me," give him the side eye, like, really? Because it happens to 52% of the men, at least one time. So one clear indication if he's having ED problems or he's on the cusp of an ED situation, a chronic ED situation, is his gums. Yeah. A clear indication is if he's having bleeding gums. Bad gum disease, 80% of men who have ED, they've had bad gum disease. Yeah. So bleeding gums is an indication that there's some gum disease onset. And if that's the case, just, have him floss a little bit more because flossing strengthens the gums. Yeah. Floss, brush, use a water pick, whatever it is, just clean around the teeth area because once the decay and everything starts to trap there, bad news. Or just visit the dentist more regularly. That's another situation, or that's another remedy, rather, that he could use. The next thing, if he's a smoker and he likes to party, excessive alcohol, and, that kind of lifestyle, that's going to impact his performance as well. So these activities usually constrict the blood vessels. And when it constricts the blood vessels, that means not a lot of blood is flowing to the areas that's needed. And when it comes to playtime, you need the blood to be able to flow and circulate to the penis so that it can have an erection. And if that's not happening with playtime, then he needs to cut down on that lifestyle, right? One more indication is if he does not have the infamous morning woody. The morning erection. If he does, then that's fine. He's healthy. But if not, and when I say not, I mean if he's not having this with regularity, okay, more than 2 or 3 times for the week, he's not having that erection, then that could be a clear sign that he needs to check with his doctor, his urologist. It could be some form of stress or fatigue. Maybe he's just really tired. Or it could be a sign that there's an onset of something more serious like diabetes or high blood pressure or high cholesterol. And for this, you can incorporate some exercise and some dietary restraints and drink some hawthorn tea. I spoke about that before. Excuse me, some hawthorn tea, or meditate or get some rest. Yeah, those are just simple solutions. And of course, get it checked by a urologist. So just to recap, LDS or ED, whichever you're more comfortable calling it, is more prevalent than you think. And for us ladies, we can help and detect the early signs by just being aware. Talk to him so that you can help your honey to heal themselves. Gum disease and missing the morning woody, those are just two simple clues. Check with his doctor and his dentist and make some lifestyle adjustments and he'll be fine. And so will you. So that's it for today's session on LDS or ED. Be aware and let him know you care. Talk to him. If you can't talk to him, then who can? Go and unleash your inner goddess. So see you next Tuesday. And this has been a Swell Quickie.